Hello everyone, my name is Solomon Steven. I'm a registered nurse and welcome back to my YouTube channel. On this channel, I simplify nursing topics to help students understand them without stress or confusion. If you're a nursing student or you have ever been confused about nursing diagnoses versus medical diagnosis, this video is especially for you. So now, let me ask you a good question. Have you ever wondered why nurses don't just write malaria, hypertension, or diabetes as diagnosis? If you've asked this question before, relax, you're not alone. Today I'll be explaining the key differences between medical diagnosis and nursing diagnosis, and I promise to make it very simple. What is a medical diagnosis? A medical diagnosis is a diagnosis made by a doctor. It identifies the disease or medical condition affecting the patient. Examples of medical diagnosis include malaria, pneumonia, diabetes mellitus, hypertension, and medical diagnosis major focuses on what disease the patient has. And once it is diagnosed, it usually does not change even if the patient's condition improves. So now, what is a nursing diagnosis? A nursing diagnosis is a diagnosis made by a nurse. Instead of focusing on the disease, it focuses on how the disease is affecting the patient. Nursing diagnosis is about the patient's response to illness. For example, when the medical diagnosis is malaria, nursing diagnosis can be acute pain, hypothermia, fatigue, or even risk for deficient fluid volume. So while the doctor treats malaria, the nurse manages how malaria is affecting the patient. We'll be moving on to the major key differences between the two. To break it down in a very simple term, medical diagnosis first is made by a doctor. It identifies the disease. It focuses on pathology. And examples are typhoid fever, malaria that I've mentioned earlier. For nursing diagnosis, it is being made by a nurse, identifies patient response, focuses on care needs. Example is acute pain related to infection. So now, why nursing diagnosis is important? Nursing diagnosis helps nurses to plan proper nursing care, prioritize patient problem, communicate clearly with other nurses, and give patient-centered care. Without nursing diagnosis, nursing care will be very disorganized. So the relationship of nursing diagnosis with the nursing process, as I've mentioned in one of my videos, nursing diagnosis is the second step in the nursing process, right after assessment. So assessment gives us data and nursing diagnosis helps us to identify the main nursing problem. So now, some common mistakes students make is writing medical diagnosis instead of nursing diagnosis in care plans. Remember, nurses don't treat diseases. Nurses treat patient responses. So, in summary, medical diagnosis identifies the disease. Nursing diagnosis identifies the patient's response. Doctors give medical diagnosis. Nurses give nursing diagnosis. They work together, but they are not the same. So, if this explanation helped you, please like the video, subscribe, and share it with a fellow nursing student. Drop your questions in the comment section and let me know what nursing topic you want me to explain next. Thank you for watching, and I'll see you in the next video.